Hello, professors and classmates. My name is Bianca Ramirez, and my ILE topic for this semester was Understanding Barriers and Facilitators of HIV-Positive Patients' Retention to Medical Care. Now, a little bit of background as why I chose this topic was because my work experience. During my interviews as a communicable disease investigators, I interviewed previously diagnosed HIV-positive patients for partner elicitation for their infections. And so I realized that many of these HIV-positive patients were not in medical care. Sometimes some of them were at one point in medical care, but then they had fallen out of care. And so this sparked my curiosity to see what the barriers were that these patients were encountering to retain their medical care. So for my research paper this semester, I conducted a systematic literature review that consisted of 16 scholarly articles. These literature reviews also contained a few evidence-based interventions. You can see the objectives that I hope to achieve in my paper, and then below are the themes that one can see throughout my paper. So a little bit of background of HIV retention. The CDC actually stated that 40% of HIV positive patients retain in HIV medical care. Some barriers that I identified throughout my research paper through the scholarly articles have been stigma, substance abuse, transportation, insurance, and perceptions. Now, there were two different types of perceptions that were identified in the scholarly articles. First off, provider perception was identified and patient perceptions. An example of a provider perception was that the providers felt like they did not need to start HIV-positive patients in antiretroviral medication right away. And the patient perception was that patients oftentimes felt that they didn't feel that their provider and staff were as involved with their HIV medical care. Now, the perceptions differed from the types of clinics HIV-positive patients attended. For example, these perceptions were more common among HIV patients who sought care in primary care clinics versus Ryan White-funded clinics. The Undetectable equals Untransmittable campaign, also known as U equals U, was established by the CDC, which meant that an HIV-positive patient that achieved viral suppression of less than 200 copies could not transmit the infection to their partners. Now, the U equals U campaign was integrated in the HIV Care Continuum initiative that was established in 2013. Now, the HIV Care Continuum initiative consists of 4 steps. The first step is to diagnose newly HIV-positive patients, followed by link them into care within 30 days. Afterwards, retain them into medical care, and finally have them achieve viral suppression. Now, another initiative that was established was the 90-90-90 goal, which was established by the Joint United Nations to end the AIDS epidemic by 2020. Now, the 90-90-90 goal was meant to diagnose 90% of HIV-positive persons in the United States, 90% provide 90% with antiretroviral medication, and lastly have them accomplish viral suppression as well, 90%. And so afterwards, a Rapid Start program was also started to achieve the 90-90-90 goal. So the Rapid Start program is meant to diagnose newly HIV positive patients into care and link them into medical care within 5 days. So the common theme that I found throughout my research paper was to achieve viral suppression, because by achieving viral suppression, it was also seen as a prevention strategy, because an HIV positive person being undetectable meant that they would not be able to transmit the infection to other partners, therefore decreasing the HIV incident rates. And so my findings will be useful to present to the HIV program manager and supervisor for Maricopa Health Department in order to find new strategies of how to meet the 90-90 goal. And we've started with that by implementing the Rapid Start program at our clinic. So every person that's tested positive at our clinic, we have linked them to their first appointment within 5 days, and eventually what we want to do is give them a 5-day starter kit so they have medication as soon as they have a preliminary positive. I hope you learned a little bit more about HIV and how important it is to retain HIV positive patients in their medical care. I look forward to your feedback. Thank you.